Hey everybody, welcome back to our weekly Facebook live cast here at Oracle Family Dental. For those of you who don't know or maybe watching it for the first time, my name is Dr. Maxwell Johnson. I'm the owner and dentist here at Oracle Family Dental. We do these live casts every week just to try to answer some questions or inform the average person maybe some of the things that they didn't know about the dental office or about dental practices. So last week we talked a little bit about sleep apnea and being diagnosed and ways to be diagnosed for that. So if you didn't see that and have some interest in it, please check it out. Feel free to ask questions or comments. But this week we wanted to talk a little bit about the kiddos that we see here in the practice and let parents know exactly what it is that me as a doctor am looking at when I see your kiddo for the first time maybe, or what kinds of things we're looking at when we look in the mouth on their first visit. And beforehand, we've talked about when the right time to bring them in is. And so today, the goal is, what is it that I'm looking at? And so when we see your munchkin or when we see the kiddos for the first time here in the practice, there's a few things that we're looking at in their mouth. One of the things that I like to look at is just to basically look at and see where all the teeth are at, and to see if things are coming in at the right developmental stage and at the right pattern, kind of fits the growth pattern for them depending on their age and how far along they've developed. So some of the teeth should be in at certain periods. If they're not, hey, that's kind of normal. Everybody kind of progresses at a little bit different period or a little bit different rate. Sometimes boys are a little bit slower than girls as far as getting teeth and things are concerned. So we take all that into consideration. One of the other things we like to look at is just to see how well their hygiene is doing. If they're good at brushing and flossing and keeping things clean, then that's a good sign for things to go coming forward. If they're struggling a little bit, then maybe we can give you a little bit of information on how to better brush or better floss, better to keep those teeth clean, because even though they're baby teeth at the time, those baby teeth then eventually turn into adult teeth, and we want to make sure that kiddos are being able to brush them and clean them effectively so that they can limit the potential for bacteria to get accumulated on those teeth and limit the potential for cavities to grow on both baby and adult teeth. So that's kind of the second thing in there that we're looking for. And the third is actually just the growth and development of the jaw and making sure that the teeth are coming together properly, making sure that things are lining up like they're supposed to, so that as things progress and as they get older, we kind of know how things are gonna continue to develop, and to see if things are going to be necessary, something like braces or something like aligners and trays, something like that may be necessary as they get older. It's nice to know that at a younger age, and just to be able to be aware of that and let parents know, hey, maybe you may be considering braces at some point in the future, or maybe not. Maybe everything is looking good and they've got nice spacing between the teeth, then braces may not be as potentially necessary. The last thing that we're kind of looking at and want to make sure that we get kiddos used to when they come in on their initial visit is just being familiar with the dental office, being comfortable coming into the dental practice on a regular basis. For a lot of people, adults included, seeing the dentist is not their favorite thing to do, even though we like to think we're probably the funnest place to be in the dental office realm. But we understand that most people don't love coming to the dentist. So if we can start kiddos out at an early age and have them have a good experience from the get-go, it's always nice to have that go on and have kids appreciate their dental visits and be comfortable coming in on a regular basis. So those are kind of the four things. Again, the teeth, making sure that things look as they should, making sure that they have good hygiene. The third thing is kind of making sure that everything's growing and developing properly. And lastly, just making sure that kids are having a good experience at the dental visit and having a good experience with the doctor and having their teeth cleaned are kind of the four big things that we're looking at when they're young in age and just kind of growing into their baby teeth and making that transition to adulthood. So if you have any questions about anything I mentioned here today, or if you have any concerns or things that you'd like me to address at future Facebook live casts, please feel free to leave comments or questions in the comment section below. I'll get to them as soon as I can. If everybody else is good, then hey, have a fantastic Thanksgiving holiday. We will see you next week at the next video. In the meantime, have a good one, enjoy it, and we'll see you soon. All right, thanks for listening, guys. Bye-bye.